Hello, my name is Petersen and I am in Practicum 741. This will be a short presentation just on some of my Practicum experiences, and then we'll refer back to the SMART objectives. So my Practicum site is with Family Practice by the Lake in Coeur d'Alene, Idaho. I am precepting under Jacqueline Wagner, who is a NP. She has her own private practice, but before that she worked in urgent care, and then another facility here, Heritage Health, and then before that she was a trauma RN. Her population is pediatric to geriatric, with a lot of, I don't want to say full mental health, but some mental health, which has been interesting. Total hours completed at this time are 57 and 0 hours remaining. So regarding the practicum experiences, it's been interesting. So I've actually had several pediatric experiences just in that short time, which was good. I was able to do a full head to toe, including the ears. The child was able to let me do that. So I was able to see a full well child exam. I had one case that kind of turned psychiatric, in which the patient actually came in concealed carrying, which we knew, but it's Idaho, so we didn't really think much of it. And then turns out he was there for a psych complaint, but became kind of triggered when the provider refused to manage any of the symptoms with Adderall. And so when that whole situation kind of happened, he became very agitated and actually kind of stormed out. And due to the nature and the fact that he was carrying a gun, we had to follow up with the Coeur d'Alene police because he admitted to having intrusive thoughts and potential homicidal thoughts. So that was an interesting case, interesting to kind of see how it was handled and to be part of it. She does a lot of testosterone replacement therapy. I've been really surprised to see how many primary care providers do not even test for this, and it has a lot of psychological effects. And also surprised to see just the crazy low levels that a lot of these patients have, and many of them are in their young 20s, early 30s, and their levels are in the 200s. I mean, I saw one the other day that was in the 170s. Normal is, at least above 400 to 900. So anyways, that's been interesting to be a part of. I've been able to give some testosterone replacement shots. Just kind of seeing her protocol for that because she has private practice. She's able to kind of do that and order meds and all that. So anyways, interesting. And then she also does weight loss with phentermine, which is kind of, you don't see that a whole lot. She has a very strict protocol in which patients have to meet certain goals by a certain amount of time, and before they're started on phentermine, they have to, undergo a cardiac, pre-screen, so EKG, generally some basic labs. So that also has been interesting because most primary care providers who are part of a larger umbrella or practice don't generally, I would say, go down that route. And then I've been able to do 2 PAP exams, which has been very insightful for learning, and the patients have been very gracious in letting me do that. So I'm very thankful for that experience, as I know at times it's often, patients are hesitant to let students try anything. So along with that too, I was able to do a breast exam on a woman who had implants. So I was able to feel the difference between the breast exam with the implants and without. So the progress regarding the SMART objectives, I met Objective 1, completed 2 pediatric exams. I met Objective 2, which included PAP exams, one completed with the preceptor watching, and the second one the preceptor watched me do it. I met Objective 3, simply identifying, specific drug regimens based on the patient's presentation. I mean, I had a patient walk in with a, infected finger, and it's like, okay, what are you going to prescribe? And it'd be Bactrim. So just things like that. Met objective 4, able to enter exam rooms, interview patients, discussed it with preceptors. So she's the only one in the office besides the receptionist. So she draws labs, she does vitals. So I kind of got to see kind of the whole picture, how she manages it all, and it's quite impressive. So, and then met objective 5. I would say I pretty much met it, but it's kind of hard because most of the time there she treats depression, but if anything is super severe, obviously she's referring to a psychologist. But she does also tell patients anytime they need to talk, if they need an appointment, she will make room for them, which I think is it's very good, especially in today's medical world system. It's compassion and compassion, and she also has a very Christian worldview, which has been very nice. So gaps identified, continuing to understand the charting. It's a very different process than that of nursing. I was really surprised to see how long it took me to do my notes. Keeping the patients on track when asking questions, oftentimes it would be too much time, and then she'd have to come in the room. And so just being aware of that and trying to keep them back on track again is really different than nursing, because normally your nursing questions are very brief. So, and then understanding the most common medication prescribed for certain conditions, and then obviously the ICD-10 codes, which I've been using them a lot, and I have some of them memorized, but there's so many. So, and that's it. Thank you very much.